My name is Harper Price. I'm a pediatric dermatologist at Phoenix Children's Hospital. Our department here at Phoenix Children's Hospital is all pediatric dermatologists, and we treat a varying range of conditions, from very common things such as acne, warts, fungal infections, to very rare complex skin disease such as genetic skin disease and vascular tumors. It's interesting, up to 20% of the complaints that a child will come to the pediatrician for are actually skin related. So 1 in 5 patients essentially coming to the pediatrician may have a skin problem. Dermatology in general is an underserved area, and pediatric dermatology even more so. It's a specialized field. It's an extra year of training on top of dermatology training, and it's really a unique set of skills that we learn to take care of children. And for us, it's a unique approach. Approaching a child is not like treating a little adult. We have a certain expertise to be able to take care of even more complex and rare conditions that may be unique to children. We are the Center for Pediatric Dermatology and the only exclusively pediatric clinic for children with skin disease. The most common things we treat are things that most people probably hear of every day. Eczema, for instance. Up to 20% of our patients will actually have eczema, which is also called childhood atopic dermatitis, an itchy skin condition. Warts, molluscum is another skin virus we see quite frequently. Acne in our teens and preteens for sure. And then we'll also see lots of birthmarks in children, like infantile hemangiomas, like sort of red strawberry birthmarks, brown birthmarks, all kinds. And those are probably the most common things that I see in my clinic every day. The term EB stands for epidermolysis bullosa. It's a rare genetic or inherited skin condition, about 1 in 200,000 to 1 in 500,000 for some of the subtypes. And it's really a big classification of different disorders under epidermolysis bullosa, but what they all have in common is a type of skin fragility. And that can be from mild to very severe. So it may just be a child that's walking around and gets blisters on their feet from lots of pressure or friction, to someone who even has to worry about a tag on their clothing causing a blister or a skin problem. We are lucky to have one of the 4 centers in the country for EB here. We are also lucky enough to do research trials here with EB and hopefully new drug trials that will hopefully eventually lead to a cure for this really rare disease. We do a lot of laser procedures at PCH. It's something unique to pediatric dermatology that we get specialized training in lasers, especially for treating birthmarks. We have a host of lasers here, which makes my job incredibly fun, and also I love to offer these treatments to my patients because they really can't get them anywhere else. We are the only place in the state right now that offers a really comprehensive surgical options for our patients for skin disease and skin birthmarks and things like that. When they come back to the office and I see a kid who used to not make eye contact, who seemed a little down, who seemed a little depressed because of their skin condition, and they come back with a smile on their face and their head held high, and they give us a hug and they're thankful, it's the best feeling ever. It's why we go into medicine. It's why we help these kids every day.